A frequent question I get is about neck and jawline. And it's one of the most characteristic things when you see somebody attractive. If you look at somebody like, say, Angelina Jolie, and you see that nice jawline, that's what people want. But people ask me, why my friends have a facelift and their neck still doesn't look that good? And the reason is the neck is one of the hardest procedures to do excellent work with. The neck and the eyes. And certainly with my background in ophthalmology and my background in facial plastic surgery and cosmetic surgery and lasers, I have the ability to do that. When we do the neck surgery, there's several things that most people don't do. If you look at the anatomy, there's skin, and then there's some fatty tissue, and then there's a muscle, what I call the Hulk muscle, this big muscle, and that's called the platysma muscle. Under the platysma is another layer of fatty tissue and what we call digastric muscles and submandibular glands. If you don't contour the deep tissues, the submandibular glands and the digastric muscles, you're not going to get a sharp jawline. When you look at most people, they look pretty good here. It's what I call the cobra neck. It looks like a cobra, but the sides don't look too good. It's because they did not address the deep structures. So if you want a natural, sharp jawline, even better than you had when you're a teenager, then you need to have an expert in neck surgery that knows how to do a deep plane neck lift. That's what we do at Oculus. We rebuild you from the inside out. So come see us at Oculus and we'll make that neck look fantastic.